in middle age from about 40 to 60 years old. Each person's body undergoes many important changes. Many internal organ functions begin to slow down, recovery ability decreases, and the risk of chronic diseases such as diabetes, hypertension, cardiovascular disease, and metabolic disorders increases. In particular, among the organs that need close attention, the liver plays a central role in metabolism, detoxification, and sustaining life. A common sign often mentioned during regular health checkups is elevated liver enzymes. Many people become worried when doctors inform them of increased liver enzyme levels, but do not fully understand the meaning, causes, or how to prevent and improve this condition. Fatty liver is not a separate disease, but a warning sign indicating that the liver is damaged or overworked. In middle age, unhealthy lifestyle habits such as lack of exercise, eating a lot of greasy food, consuming alcohol, smoking, or living under prolonged stress can all weaken the liver. Taking the initiative to learn and adjust your lifestyle starting today will help protect your liver, maintain your health, and prevent many risks during this important stage of life. First, let's find out what liver enzymes are and why this index is so important for middle-aged people. Liver enzymes are actually enzymes located within liver cells, involved in the body's metabolic processes. Normally, these enzymes are kept inside the liver cells, but when the liver is damaged, the enzymes leak into the blood, causing the liver enzyme levels to rise in tests. Among the commonly checked liver enzymes are AST, or SGOT, an enzyme found not only in the liver, but also in the heart, muscles, and kidneys. ALT, SGPT, more specific to the liver, which increases when the liver is damaged. GGT, very sensitive to the effects of alcohol, tobacco, and medications. And ALP, which often increases in cases of bile duct obstruction or bone diseases. The significance of elevated liver enzymes is a sign that the liver is affected, possibly due to toxicity, inflammation, or liver cell damage. If this condition is ignored and persists for a long time, the risk of developing chronic hepatitis, cirrhosis, or even liver cancer is very high. Therefore, detecting and adjusting liver enzyme levels plays an extremely important role. So, what causes middle-aged people to be prone to high liver enzymes? First of all, lifestyle factors play a major role. Regular alcohol consumption is the leading cause. Alcohol can directly poison liver cells, causing liver enzymes to rise rapidly. In addition, cigarettes are also an enemy of the liver because they contain nicotine and a host of chemicals that cause oxidative stress, damaging the liver. A diet high in fats, red meat, and sweets not only increases the risk of fatty liver, but also causes liver enzymes to gradually increase over time. A sedentary lifestyle also contributes to fat accumulation, metabolic disorders, and negatively affects liver function. In addition, underlying diseases are also unavoidable factors in middle age. Viral hepatitis, especially hepatitis B and C, is very common among Vietnamese people. If not screened and treated promptly, the disease can easily become chronic, causing prolonged liver cell damage. Non-alcoholic fatty liver disease, often seen in overweight individuals, diabetics, and those with lipid metabolism disorders, also contributes to elevated liver enzymes. People with cardiovascular disease, diabetes, and metabolic disorders are all at risk of impaired liver function. In particular, early-stage liver cancer often only manifests as a slight increase in liver enzymes, making it very easy to overlook. The use of medication is also a cause that cannot be overlooked. Painkillers, fever reducers, such as paracetamol, antibiotics, cholesterol-lowering drugs, if used for a long time and not according to the prescription, can cause liver toxicity. In addition, prolonged stress and insomnia disrupt hormones, directly affecting liver function. As age increases, the liver's ability to regenerate and recover gradually decreases, increasing the risk of elevated liver enzymes. One notable issue is that most people with elevated liver enzymes do not have clear symptoms. This is why many liver diseases progress silently and are only detected when dangerous complications have already developed. However, in middle age, if you pay close attention, you may notice some of the following signs: fatigue and prolonged weakness due to the liver's reduced ability to filter toxins, loss of appetite, bloating and indigestion caused by metabolic dysfunction, dark urine, pale stools, itchy skin, jaundice, yellowing of the eyes, signs indicating serious liver damage, pain or discomfort in the right upper abdomen. Most importantly, you should not wait until symptoms appear to see a doctor, because many liver diseases progress silently, and the later they are detected, the higher the risk of complications. So how dangerous is elevated liver enzymes? When elevated liver enzymes persist, it indicates that liver cells are continuously being destroyed. Without intervention, the liver will gradually lose its ability to regenerate, leading to cirrhosis, a condition where the liver becomes fibrotic and can no longer effectively perform detoxification and metabolism functions. More dangerously, cirrhosis is a stepping stone to liver cancer. Vietnam is currently one of the countries with the highest rates of liver cancer in the world, mostly due to viral hepatitis and prolonged cirrhosis. Additionally, people with elevated liver enzymes often have accompanying blood lipid disorders and diabetes, which can easily lead to heart attacks, strokes, and seriously affect quality of life. Who is more likely to have elevated liver enzymes in middle age? Men who drink a lot of alcohol are the highest risk group. People with abdominal obesity, overweight, and underlying conditions such as diabetes, high blood lipids, and hypertension also need to be cautious. Those with a history of viral hepatitis, long-term use of painkillers, lipid-lowering drugs, antibiotics, stressful work, and lack of sleep are all at high risk of elevated liver enzymes. Proactively undergoing regular health checkups is a practical solution to prevent dangers. To prevent and improve elevated liver enzymes, lifestyle changes are the decisive factor. First, minimize alcohol and tobacco consumption as much as possible. Not only does this help keep the liver healthy, but quitting these habits also reduces the risk of many other dangerous diseases. Ensure you get enough sleep, from 7 to 8 hours each day, allowing the liver time to recover and regenerate. Effectively managing stress through methods such as meditation, deep breathing, yoga, or simply spending relaxing time with family and friends also helps the liver function better. A healthy diet is an indispensable medicine. Increase intake of green vegetables and antioxidant-rich fruits such as oranges, grapefruits, apples, carrots, spinach. Choose good fats like olive oil, sesame oil, avocado, and salmon instead of animal fat to reduce the burden on the liver. Prioritize liver-protective foods such as artichokes, turmeric, garlic, and green tea. Minimize fried foods, red meat, and sugary foods. Drinking enough water daily helps detoxify the body. Exercise also plays an important role in improving liver function. Gentle exercises such as brisk walking, cycling, swimming, yoga, and Tai Chi not only help reduce weight and lower blood fat, but also enhance blood circulation to the liver, supporting the detoxification process. At least 150 minutes per week should be dedicated to physical activities, evenly distributed each day to form a good habit. In addition, screening and treating related diseases is indispensable. Regular health checkups, liver enzyme tests, and liver ultrasounds help detect abnormalities early. Proactively getting vaccinated against hepatitis B to prevent the risk of infection. If you have conditions such as viral hepatitis, lipid metabolism disorders, or diabetes, you need to follow the treatment as directed by your doctor. Absolutely do not self-medicate with liver supplements of unknown origin to avoid causing more harm than good. To help middle-aged people with high liver enzymes have an appropriate diet, below is a suggested menu for one day. Breakfast. Oatmeal porridge combined with fresh fruits such as apples, pears, and kiwi. This is a source of food rich in fiber, vitamins, and minerals, helping the liver to gently metabolize and reduce its burden. Lunch. Brown rice, rich in fiber, low glycemic index, pan-seared salmon with olive oil, boiled vegetables such as broccoli, carrots, and pumpkin. This menu provides high-quality protein, good fats, and supports liver function. Snack, avocado smoothie, or nut milk, such as walnut milk, almond milk. These foods are rich in omega-3, good for the heart and liver. Dinner, artichoke soup stewed with chicken bones. Artichoke helps protect and restore liver cells. Boiled chicken breast, fresh vegetable salad. Light and mild eating helps the liver digest easily in the evening. Dessert, a glass of green tea or an apple. Green tea contains many antioxidants, supporting liver detoxification. In addition to diet, simple daily exercises are also very beneficial for a healthy liver. A brisk 30-minute walk helps improve blood circulation and supports liver metabolism. Yoga poses involving twisting and bending not only help relax, but also stimulate blood flow to the liver. Deep abdominal breathing is an effective method to reduce stress and increase oxygen supply to liver cells. For middle-aged people, Tai Chi or Qigong are ideal choices, gentle yet clearly effective. However, there are signs that you need to be alert to and seek medical attention immediately. If you notice obvious jaundice, yellowing of the eyes, severe pain in the right upper abdomen, rapid unexplained weight loss, dark urine, pale stools, or a family history of liver cancer or viral hepatitis, proactively go to the hospital for a checkup. Early detection plays a decisive role in treatment and preventing dangerous complications. After all, elevated liver enzymes are a warning bell that should not be taken lightly, especially in middle-aged people when the body has undergone many changes. Early detection and timely lifestyle adjustments will help you prevent serious diseases such as cirrhosis and liver cancer. The important thing is not just taking medication, but making comprehensive changes, eating healthily, exercising regularly, maintaining a relaxed mind, and having regular health checkups. Remember that a healthy liver is the foundation of a healthy life. Protecting your liver today means protecting your health and happiness in the future. Don't wait until your body signals a problem to take action. Proactively care for your liver every day to live fully, healthily, and peacefully with your family and loved ones. That is the greatest gift you can give yourself in middle age and in the years to come.